All right, welcome back to another episode of Innovators of Health. Today we have Dr. Thuy Ho Ellsworth from Aligned Foot and Ankle in Austin, Texas. And Dr. Ellsworth, it's a pleasure to have you. And with my co-host, Dr. Desai. Here we go.
Thank you. Thank you for having me, guys.
So here I'm going to start with a little bit of your origin story. I think you have one of those classic American dream stories because of you coming, as a refugee going from Vietnam to, I think, Thailand to Indonesia, then the United States, and your first occupation was correct me if I'm wrong, an English teacher, as a second language English teacher, correct? At the independent schools of Austin?
Mm-hmm. As an ESL school teacher, yep.
And then you chose to pursue podiatry,
That's right.
So talk a little bit about that. Like, what was that journey like, and how did you get to this? How did you choose this?
Yeah. How did I get into podiatry? I get that question a lot. So I started out, I went to the University of Texas, got my degree in education, and I spent 3 years as an elementary school teacher teaching ESL in a bilingual Vietnamese program. And I enjoyed it immensely, but I also took on volunteering as a ESL teacher for the parents of the students. So I was doing that in addition in the evenings. So I honestly kind of did it to myself. I really burnt myself out. And I'm one of those people, like, when I do anything, I'm like extremely passionate about it and I'm all in. But I burnt myself out. But really, my degree in education was life sciences. And so a part of me was kind of missing that science component. And so I decided to go back to school. But really, it all started even while I was teaching. I was volunteering, and I came across a podiatrist who was doing a lot of reconstruction, foot reconstruction. And it hit close to home because my brother was born with a clubfoot deformity. And for those who don't know what that is, it's like your feet are like turned inwards and you're literally walking on the sides of your ankles. And so this was during in 1973 in Vietnam. And my mom was brave enough to, they were trying to cast him out and he was in a lot of pain. So my mom took him and, like here we have like a stepwise approach to casting those type of deformities out. But back in Vietnam, they didn't know that. And so they just kind of cranked him out, put him in plaster, and it was a lot of pain. So my mom soaked it all off. He was crying relentlessly and soaked it all off. And she's like, I've got to find an American doctor. And during the Vietnam War, there were, these army bases that were down there. And she was brave enough to take my brother down there and say, I need to find an American doctor or surgeon to help fix my son. And, lucky for her, there was a surgeon there and he took my brother in and did reconstruction of both his feet. And, and now my brother, even though he's the shortest one on the high school basketball team, was the fastest one, most accurate shooter. And he still, plays tennis and pickleball. And if it wasn't for the surgeon that changed his life, he wouldn't be doing those things. So when I saw that, it really hit close to home. And I was like, I think this is kind of what I want to pursue. And that's how I got into it.
Amazing. Oh, that's beautiful. What a journey. So so when did you first become interested in red light therapy, and what made you, bring RedVive into your podiatry practice?
So how I got into red light is actually kind of a more superficial, aspect. I was like, I'm obsessed with skincare and I wanted all the things that were anti-aging. And, and growing up, my mom, like, she wouldn't even buy me makeup. But when I turned 13, she took me out and like got all the best skincare products. So I was, started out in life with like, hey, stay out of the sun, use good skincare products. So that's been ingrained in me. And so when I learned about red light therapy as an anti-aging, I went out and I bought the Dennis Gross mask, right? And I wore it religiously every night. And I don't know if it's a combination of everything that I do. I was just like, I get a lot of compliments on my skin. And so, and be consistent with it. So, when I've had my practice now in Austin for about 3 years. Before I opened up my private practice, I was in a multi-specialty group, kind of, working and practicing medicine really out of the confine of the box that I was put in to practice like just traditional approaches, right?
Mhm.
So when I kind of got tired of that, I left and started my own practice. My goal was to really start kind of a holistic regenerative center, things that really weren't being offered here around the Austin area yet, not for podiatry, anyways. So I really put everything into the regenerative, minimally invasive, and holistic basket. And so when um, um, and I think actually it was Justin Finneman from CBD Curable that connected me with you guys. And,
Mhm.
and when got on a call with Dr. Desai, and he went over the benefits of the Red Vive, and he didn't have to convince me too much on the red light therapy, but what really intrigued me was the near infrared and what the Red Vive offered.
Mhm.
So, in my office, I already offer things like shockwave therapy, class 4 laser therapy, and I thought, wow, this really kind of falls in line with everything I'm doing. And I knew that the red vibe was just with the combination of red light and near infrared, there's going to be deeper penetration than what I was just using for my face, right? And I really liked that it was a whole body panel. So so selfishly, I was like, okay, I want this, right? Um, but then when I got it, I loved it, but I had actually this issue where I have like a herniated disc of C4, C5, and every now and then it acts up. And I thought, I'm going to use this on here. And it had been a week, and I've been taking anti-inflammatories, and it's just like rubbing like topical products on there. And I just got under that red line. I bought it really for home use first, and I did 10 minutes front, 10 minutes back, and just really focused it on my back. By the end of the week, I was like, wow, it was amazing. I was like, this is it wasn't bad enough that I needed any kind of interventional injections or anything, but I could see and feel the warmth, and this thing was so much more powerful than my little, mask, that I stopped using that, and I just now use this religiously. And I have one for home use, and then I have one for my patients, as an in-office use.
Yeah, it's just to speak to that, Dr. Sweet. Similarly, when I've been using photobiomodulation for quite some time in the practice, and from laser therapies to sending patients to clinics that had $100,000, $150,000 beds, and I thought that was like, if it's 150,000, it must work better. These panels, aren't going to provide enough intensity, and it was really that experience of getting that panel, because I felt the same thing at first. I brought it home. I was very skeptical. I used it, and I suffer. I've L4-5. I have Ehlers-Danlos, so I have like a Biden score of 9. So I'm hyper flexible everywhere, and I have a listhesis at L4-5 in my low back. SI joints really unstable, and I started using it, and that was that intensity and that almost immediate like pain relief. I said, this is something different. Like, it's so powerful that, and we can have it at home. And then what I've experienced in the last 18 months, just to speak to, is like this whole body stimulation not only does it help like the area that you're treating, so say you're treating the skin or the back, it's influencing your entire system.
Mhm.
You know, I'm vain too, and I have like some age spots that came in a few years ago. I'm 51, almost I'm 50, getting on 51, and I don't irradiate my face, and they're gone. And it was consistent use over the past 18 months, and it's crazy. It's like literally, I like look for it. I'm like, where'd that? Because it was obvious to me, and and it went away with just systemic use, and it's so cool to see. And that's what I kind of wanted to hear as you has started to use it and leverage it for yourself, but also for your patients. Are there any clients or cases that come to mind that you might have been surprised by, or how maybe how you used it in a different way, or
Yeah.
how have you experienced it?
For sure. I mean, again, I'm one of those people where I don't back anything up or promote anything to my patients unless I'm a firm believer in it. And I think that, it's funny because I just turned 50 this year as well. And
Hey,
so,
welcome to the club.
I'm sorry. Yeah, exactly. So I know the feeling. But for me, for what I do in the office, I use, like, for example, class 4 laser therapy, right? I have 3 lasers in my office and they run nonstop. And my patients that are like super skeptical about class 4 laser, it's deeper penetration. You're looking at 6 to 8 centimeter penetration, which you can only get in a doctor's office. You have to be a licensed professional to operate and get that type of treatment. But on my patients, when they get, whether it's plantar fasciitis, tendonitis, midfoot arthritis, any kind of like inflammatory condition or pain, they are always wowed even with the very first treatment. And so there's a sense of like, whoa, like my pain is already reduced with one treatment. And then I tell them that, serial treatments help. But Red Vive kind of falls right into um, these treatments because now the patients can come in, they can get the treatment in the office, and then they can go home and prolong the effects of what they're getting. And so it's very synergistic, but it's almost, it provides that patient with a comprehensive package, right? You're getting it here in the office. We're going to continue this treatment at home. So you can imagine with podiatrists, we treat everything foot and ankle, lower extremity. I see a lot of people with poor circulation. I see a lot of people like diabetics, whether it's diabetic peripheral neuropathy or idiopathic neuropathy. You're looking at like conditions that whether there's inflammatory factors that contribute to the neuropathy. And then you've got a lot of inflammatory conditions like tendonitis, plantar fasciitis, joint pain, things like that. So when we do these treatments, a lot of my patients that have chosen to continue with Red Vive therapy at home, they come in and go, wow, it really has given me kind of like the continued effects. Because even with laser treatment, they get the effect and they go, okay, it's good for maybe a day or two. And then they got to come back in the following week and continue. So we do treatments anywhere between 1 to 2 weeks. But now they're seeing like, hey, this allows the treatment that I'm investing in the office to just kind of, continue at home and the prolonged effects of it. And so, it's been great. I mean, my patients are also reporting like better sleep. Um, they're having improved pain with, they would tend to have pain just sitting around, and now like the pain from neuropathy is significantly reduced. And so, and the other amazing thing is, I have patients who have like, for example, Raynaud's, which can be very painful, and I'm talking about severe to where I've had to do um, amputations because with Raynaud's, if you're not familiar with Raynaud's, what it is, it's basically your body reacts to temperature changes where you have vasoconstriction of the vessels. And so in some severe cases, the vasoconstriction doesn't let up. And then that blood flow just cuts off, like say to part of the toe, no matter how much you try to stimulate or re-stimulate. And so I don't know if you guys remember with Texas, the kind of around, I think 2022, we had like that
Cold spell.
snowmageddon where,
Hmm.
you know,
Yeah.
the whole state froze over. I've never had to do so many amputations in a week, you know, because these patients that had Raynaud's and they weren't diabetic, you know, but because of the Raynaud's and the extreme cold temperature, it didn't come back. So then I have these patients that come in, they have partial toe amputations, and they're very worried that they're going to be in the same predicament or the same circumstance. I put them in front of the Red Vibe and they just, you know, I have a panel in my office. My patients get to use it for free. Um, they feel the warmth of it, but they almost, you know, a lot of them are like, wow, I kind of almost feel like the circulation like improving in my feet. And that's exactly what it does, right? And so so these patients love it and it's safe because you know, again, I have patients who are diabetic with neuropathy. How many people have sat in front of space heaters and caused, you know, trying to warm up their feet and
Mm.
caused burns to their own feet that have caused, you know, that required surgery or amputations. So I see that a lot too. So this is such an amazing device that allows my patients who are neuropathic or vasculopaths that can sit in front of it safely, get the warmth that they need, get the stimulation of the circulation back in without the side effects or risks.
Very cool. Have you seen, one of the kind of the scientific uh, discussions that's been ongoing in some of the literature that's out there is kind of reinnervation, especially with these peripheral neuropathies, uh, with continuous exposure. And that's one of the things that we've seen with um, even some of the laser therapy. It's the same in many ways, depending on what laser you're using. The medicine is the same. It's just delivering it. It's a different delivery system. If the laser is like a needle and a syringe, I liken the red vibe maybe to like a sponge and like dipping if the tissue's the sponge, you're like dipping it into the bowl. Maybe you're not getting as deep, but you're getting that, broader like penumbra of effect. And there is a lot of discussion around, seeing peripheral neuropathies improve, not just symptomatically for that exposure time, or like say the day or two that they get that improvement, but over time that neural inflammation, that baseline, is actually changing and
Mhm.
allowing remyelination and healing. That's going to take months to years. But are you seeing trends towards that, in your patients? And
Yeah. Oh, for sure. I mean, that's exactly what I do here in my office, right? And so what I do is I have I do ABIs, which is like the ankle brachial index measurement to check for blood flow. And then I have a pseudomotor, I perform a pseudomotor study so it can actually kind of check like the C fiber, whether there's inflammation around the nerve or there's, you know, the nitric oxide levels or activity. So we measure those things first and determine, and patients like to see those numbers and see that, oh my gosh, okay, my sensations I'm feeling is legitimate, right? It's, you know, there's an explanation for it. And so then what I do is I start them on a program with class 4 laser therapy. And in some cases, I combine it also with soft wave or unfocused radial shockwave therapy. And now, basically, instead of relying on, some of these medications that have these adverse effects, these regenerative modalities basically harness the body's ability to reduce inflammation or reinnervate, revive, and repair what's pathologic. And so I will do a kind of like a Sims Weinstein. I'll measure patient sensation before and after these treatments, and they come through and they do a series of treatments, and the vast majority, I can't say 100%, okay, depending on the patient's conditions and severity, but the vast majority have increased sensation. And so these are the same people that are very skeptical about the red light panel. But when they come in and they get their class 4 laser, while they're waiting, I put the red vibe up up against their feet, their legs, and while they're sitting there and they feel it, and then they can see the difference. And so and then I just tell them, I say, I really want you to, continue this therapy at home. So whatever you're investing in, whether it's time or money, that it continues to work for you. So I'm seeing a
Yeah,
big difference. Yes.
that's amazing. I have a very close friend here that's a podiatrist in Portland, and he's taken care of me on multiple occasions, and he's a saint. One time I was going to his office after hours, and I ran out of gas. He literally came and got me, and then he cut the callus off the bottom of my foot because I couldn't walk. He's like a saint. But I got
Wow, that's
I got a
service.
divine. Yeah, that is he's truly Dr. Superling. He's amazing. Thank you, Chris. So I got a I got a like to him, and I wanted him to try it. And he had some patients that were really, I think he had done like a surgery, and there was a sural neuropathy, like continued pain, severe pain on the patient. And I got him the panel, and he sent it home with her. Just said, hey, try this. We don't, not sure if it's going to work. We just gave it to the patient, and he called me like a month later and said she dropped it off. She used it and she dropped it off, so it didn't work. And then a couple of weeks later, he called me again, and he said her pain is way better. She wants it back. And so I just left. We left it there. So it took time for that exposure to work, and that's the thing that's really interesting. There was some articles in Dermatology Journal of Academy of Dermatology uh, that talked about the laser and combining that, and I think that's really like novel, and I love that you're doing that. And I feel like sometimes when we're talking to some docs, there's a concern because they've invested heavily in this, like when lasers are amazing, right? It's the same medicine, it's just different delivery mechanism, and they're kind of afraid of cannibalizing that with Red Vibe. And we talk to them, and that's it's no, this is super complementary. It's like, you know if I liken it to, maybe this is not maybe the best example, but it's like physical therapy. You go to a therapist, they're going to work on you and they're going to help you, but you got homework. If you think you're going to get better just by going to the one physical therapy session and seeing once a week or every other week, you're not going to get better. It's going to take you forever, or you may not get the results that you want. You got to do the homework. And that's where I think that this
Exactly.
is the perfect adjunct. But can you speak to that? And do you feel like, did you worry about that when you started, when you were looking at Red Vive, or do you feel like you already knew
You
hey, this
know,
is going to be a perfect fit?
yeah, I wasn't worried about it like cannibalizing it because I felt like it wasn't substituting or replacing it. But I was worried about, do I have the time as a provider to go over all of this? And the great thing about the way the Red Vibe team is set up, in a way, it's that, I literally just kind of prescribe it, right? It's part of, hey, this is what we're going to do today here in my office. And I want you to also continue with this. And in a way, it's almost like I'm writing a prescription. And then the Red Vibe team is calling the patient up and going over all those things. So it's not something that is burdening my office or front desk or anything at all. And the way that they've like set it up, it's very efficient. And so I think I wasn't concerned that was gonna cannibalize what I was doing, because I knew that it was going to really work, um, synchronously, and just kinda give that entire continuum from office to home. But it was more, how much of this is gonna consume my time? And fortunately, you guys have such an amazing team. I don't feel like it's impacted my workflow whatsoever.
Thank you for that. Thank you for
Yeah,
those kind words. So, I mean, we were talking a little bit about skepticism. So, in the context, for other podiatrists or surgeons who are curious about red light therapy, what advice would you give them about evaluating or adopting a system like RedVive?
It's really funny because I guess for me, I'm one of those people that, I when I jump all in, and then if I believe in it, then I go all in. If I don't believe in it, I abandon it. So I am a big, within my community, um I am one of those people where I don't believe in gatekeeping anything. I want to share as much of my experience and knowledge and what good experience I have with other fellow doctors, because to me, I'm kind of, helping my profession when I do that, and promoting my profession to kind of, just to continue to grow and elevate and evolve, right, in what we do, because it's so easy to kind of get stuck in our own boxes. So when I talk to a lot of these doctors, for example, Rahul and I just, the Chicago conference that we did, I did 3 lectures on regenerative medicine. I did one on minimally invasive surgery, and then just one on efficiency, like the algorithm of my practice and what you can do. And in a way, they all flowed together, because if doctors can like look at what can we do for our patients from start to finish, and comprehensively, you're going to have happier patients. And again, when I promote regenerative therapies, and that includes everything from shockwave laser, stem cell allograft injectables, uh, those types of things, it's hard for people to embrace new products, and then they're kinda like, "Is this experimental? How well does this work?" But when you try, for example, I really promote laser therapy, and I tell patients and other doctors, "Just try 1 session," because you will see the difference. And I was very skeptical the very first time, and I said, "What's this all about?" But I am also one to not fall behind on any advancements or the latest new gadget or
Uh-huh.
toy. So I get in the laser, and I had some pain inflammation in my like carpal tunnel area. I did it, and I was just like, 1 treatment, and I was like, wow, this is amazing, right? And so now with my patients, I tell them, just try 1 session, whether it's tendonitis, plantar fasciitis. That's it. And if you don't like it, like, fine. You don't have to, but I recommend a package treatment, because a series of treatments, it's like taking 1 antibiotic, right? You're not going to get the full effects. So I tell other doctors the same thing. And so if you try it yourself, there's no better testimonial, right? And I think it's I think for you to believe in it, try it, you'll believe in it, your patients will kind of feel your conviction, when you believe in it as well. So I think that, products like this, it's really hard for people to embrace when it's kind of new, but I think for you to kind of stand out in your profession and your community as kind of a forward-thinking, advanced, doctor, you can't not have these modalities, right? And even if you have, because I wasn't even sure with the Red Vive the first time. I was like, "Yeah, let me try it," right? Because here's the thing, how many of us hop on the internet and pull up red light and, "Oh, it's on Amazon for 199 or whatever," right? And then it's like, okay, how do you know that product versus this product? Like, what's better, right? And so with the Red Vibe, I saw when talking to Dr. Desai, what he was doing really fell in line with what I did, from this research that he's done and all the research that backs it up, from what he would prep the patient or prime the patient using Red Vibe before, doing any kind of PRP treatment, and seeing the significant elevation in the cell count. And say, I mean, you can't, research doesn't lie, right? Facts don't lie. And so when you see those numbers, and so I said, you know what? Yeah, let's try it. And so I brought it home. I got it for myself just to try. And I saw the benefits of it. I mean, now I gave my stepdaughter my Dennis Gross mask, because I've got something so much more powerful. And just seeing the difference from just like my husband, he was he's also part of my practice, but he's extremely fit, very, he was a sergeant on the SWAT team for APD for 10 years, right? And all the training, all the abuse his body's been through. So he's got chronic things that arise here and there, and he loves that thing. He'll work out, and as soon as he's done, showers, and he lays under the red light every night. And so both of us sleep well, and and any kind of chronic issues, we can see the faster recovery.
How do you
That's great.
see, Jay, can I ask you a question? So how do you see in your practice, like looking, you don't have a crystal ball, but you integrating this, and I know the integration is slow and acceptance is sometimes slow. Uh, I really appreciate your open-mindedness. I think it's huge, and I'm super excited to continue to work with you on the regenerative medicine space. And just an aside, I saw this same thing when we started using PRP and regenerative medicine in 2008, and over time, there were so many folks, just like with red light therapy. I feel that kind of wave is coming because it's such a powerful device. It can be used at home so many ways in helping, but there were so many folks that maybe were doing it the wrong way, and it gave the overall medicine like a bad name. And I think that's where there's that opportunity, and why I'm so excited to work with Red Vibe is really dive into the science, just like we did with regenerative medicine and PRP and stem cells. That if you do it the right way, it's magical. It's all magic until it's science, but it's pretty damn magical. And I think that that same thing can be said. What do you think, like, as you're starting to see this integration and patients seeing this, what's your vision for like photobiomodulation in general and red light therapy, like 3 to 5 years? Can you see it being more a part of your practice, extending?
Oh my gosh. Yeah. Yeah, for sure. I mean, I think regenerative medicine is the wave of the future, and I think that even though there are slow adopters, I think anything new and different, you're going to see that pattern. But I mean, I tell people all the time, regenerative medicine, photobiomodulation has truly breathed new life into podiatry, into my practice. I know that, I get a lot of patients that come from far away because they've Googled regenerative. Patients are very educated with information now at the tip of their fingers. They'll do their own research and they will find who has what they need, and they don't care. They will go there. And so I've had patients that come in from other cities. I've had patients that have emailed me from other states, just like because on my website, it's, my focus is on regenerative medicine. And so they like want just holistic regenerative treatments now. Nobody wants any of the anti-inflammatories and steroids because they know the side effects of that, right? And nobody wants that. And so I truly believe that and I tell other doctors all the time, if you don't start adapting and evolving into the regenerative space, you're either going to fall behind or you're going to be extinct. And I think this is truly the wave of the future. And I really think that if you don't hop on that wave now, you're really going to fall behind.
Dr. Thuy, this has been fantastic. And
Taylor, did we lose you? I think he has a little one that's coming into the
I had to
picture.
mute myself, otherwise my daughter was going to be all over this. And,
Hey, that's okay. We're
and
all...
she was showing off her feet, and I wasn't sure.
Oh,
I was like, you don't have any feet problems. So,
oh, poor girl.
but no, any last parting words? Because this has been fantastic. Anything that we haven't asked you that you would like to
I
say?
think, yeah, I think that, as a provider, I think that we're really doing our patients a disservice if we're not offering these modalities. And this is truly these modalities, whether it's, you know, regenerative medicine, regenerative therapies, and photobiomodulation, it is a huge puzzle that's missing from conservative to surgical. And I really think that this offers our patients an opportunity to heal and repair and restore without severe or aggressive treatment or the need for surgery. It really is preservation and restoration. And you know, which is everything I practice, you know, with for my clinic. That is really what I truly believe in. It's about joint salvage, joint preservation, and restoration. And I think if we are not offering these modalities to our patients, we're doing them a disservice. They need to know, and they need these, they need to know that these are options. And I think that what we do in the clinic and what we offer at home is so vital. It allows that continuum to you know, for the patient, so that their treatment is comprehensive, and as a result, I think you just get more. You have satisfied, happy patients. I can't tell you guys how burnt out I was before I started my practice. And starting my practice was probably one of the hardest but most satisfying things I've ever done, because I'll have the opportunity now to bring these modalities in that I wouldn't have had if I stayed in a big group or hospital group or whatever. But um, I'm so happy when I go to work, and more importantly, my patients are so happy. You know, and that I think gives me such a fulfillment and satisfaction in what I do.
That's beautiful. Thank you so much, Dr. Thuy, and
Yeah,
thank
for
you,
doing
Rahul.
that. That
This
was amazing. Thanks, Dr.
is
Thuy. Thank
amazing.
you
Awesome. Thank you
for doing
guys.
this. Your
So, hey, I'm
patients,
gonna
thank you too.